to learn about the peculiar and yet common medical practice of applying leeches, I've come to meet consultant urologist Jonathan Goddard. George had these really weird little puncture marks around his knees, and what we think those were scars from where he'd had leeches applied.
In the early 19th century, they were still thinking about the balance of humours. So you know that if there's too much blood in an area, then they would bleed someone. Well, the leeches, that's the natural way of doing it, because that's their job, to suck blood.
Speaking of which, Jonathan.
Speaking of which.
You have actually volunteered.
I'm happy to.
To let me stick one of these leeches on you.
Absolutely right.
So I think we should open the jar. Got him. Okay. And I'll pop him on there and we'll see if he's hungry.
I'm sure he will be.
I can't even tell which is the head end and which is the tail end.
Well, I can tell you that this is the head end there, as he's attaching to my hand there.
Can you feel it?
Very slight tingling, pricking sensation. And he's just going to have a little drink, and then when he's full, then he'll just drop off, and that's that.
I mean, you use leeches in very, very targeted ways today.
Oh, yes. Yeah.
Things like plastic surgery where you're trying to drain the blood out of a bruise.
Yeah.
Presumably leeches wouldn't actually work for treating gout.
No, because remember, we're looking at the balance of humours, which of course is, I'm afraid, it's rubbish, isn't it?
Yeah, it is. He's looking fatter already, Jonathan.
He's clearly quite hungry.
How long do you think it's going to take him to be full?
About half an hour, I think.
Right. It's quite disgusting. We can see from the number of scars on George's body that his doctors had been trying hard to treat his ailing health. As well as this, George's anxiety over his physical appearance was increasing.
By the time he was king, he was quite morbidly obese. He made the neckcloth famous because it hid his double chin.
He was a very vain man and loved fashion, considered himself a bit of a dandy. He would have found it very difficult to deal with his changing appearance.
What news?
The king's illnesses give me employment in abundance. His legs, knees, and ankles are all so swollen. The blooding appears to have little effect.
Wellington insists that the king's infirmities are just the result of strong liquors, taken too frequently and in too large a quantity. HM's ever-expanding waistline has also not gone unnoticed.
Any bigger and he'll need some sort of wheeled chair to get about.
I'm sure he'd love that. He's already issued an edict that servants are to avert their gaze should he be passing. Anyone caught staring, I am to discharge.
George was far from alone in caring about his appearance. In the Regency period, style became a serious pursuit, ushering in new trends in architecture, interior design, and clothing, resulting in a very fashion-conscious and weight-watching society. This is wonderful. This is the original ledgers of Berry Brothers and Rudd. It is extraordinary. So what we've got here is a record of the well-heeled gentry coming here and getting themselves weighed. And then when you get towards the back of the book, there's an anonymous page. And it's somebody who's coming in for the first time in 1791. The very first entry, he weighs 17 stone and 4 pounds. And sometimes they have gout. So this is a large, well-off gentleman who suffers occasionally with gout. The suspicion is that this is the Prince of Wales, that this is George. Despite being conscious of his weight, it was impossible for George to hide away from the public and the cruel satirists ever eager to ridicule his ballooning size. Maddie, we've got some wonderful caricatures of George here, haven't we? Where should we start?
This is
an absolutely skewering satire about a connection that the public perceive around George's physical gluttony and some kind of moral failing in him. And he's shown as someone who has no self-control, who is set to one day become king and really is going to lead Britain down a dangerous road.
Oh my goodness, is this George as a whale?
It is. So it's a play on him being the Prince of Wales and
Yes.
the maritime beast.
It's interesting, isn't it? Because there's all those kind of layers of politics, but then at the centre of it, you've got this very obvious comment on his body. You know, this is about body image.
Absolutely. It's this idea that George's body and George's political public identity are absolutely interlinked.
Yeah.
But we know that George here would have seen this version of himself, and I think it would have been hard to take.
We haven't even opened the body yet, and there's plenty to see, plenty to look at. We can see that he was severely obese. He was consuming high levels of alcohol, has been for some time. We also know that he was consuming high levels of opiates in the form of laudanum on a daily basis, and he was likely addicted. We can also see that his doctors were trying to treat him. There's plenty of evidence, but there's something else that we know that he was particularly concerned about, because of course his father, George III, had suffered seriously with mental health issues. George was becoming increasingly worried about his mental health because, of course, his own father, George III, was well known for suffering from a form of madness. Over the years, historians and medics have tried to understand the root cause of that madness and whether or not it could have been hereditary. So could George IV have suffered from the same disease, and might that have hastened his demise?
Your Majesty, I see you're up and well.
I am in a state of lassitude which seems to follow each attack. Leave us. How uncomfortable and how miserable I always feel when I don't have you immediately at my elbow.
It is my honor to serve.
I have such worries, Sir William. Worries that I am fast becoming my father.
Your Grace?
Mine is a very nervous and delicate fibre. These disorders I suffer seem to owe their course to the mind. Any anxieties tear my feelings to shreds and unhinge the whole system. I fear I'm a victim of the family complaint, and it clouds my every thought.
George suffered various crises of mental health in his reign. He was emotionally immature anyway. He really struggled when anything didn't go his way. He kind of had these fits of temper and these kind of long depressive episodes. Several courtiers were definitely concerned that George himself might actually have inherited this disease that was going to take down the royal family.
To try to gain some insight into the mental malaise that appeared to blight the House of Hanover, I've come to the Royal College of Physicians. I'm meeting Polly Putnam, who has studied the correspondence of George III's physicians. Polly, this is appalling handwriting, as befits a doctor, but you can read it.
This whole document is looking at what a definition of insanity would be.
I can see the word insanity here, even with this terrible handwriting. Yeah.
So he writes, I should look upon that insanity as likely to prove incurable. It's because the stakes are so high. You're not just an ill person, you're kind of an ill country, or the embodiment of a country as well. And I think this is very interesting. It may be a family complaint. So he's wondering whether this is something that's hereditary.
Yeah.
So,
and this is what George IV was particularly worried about.
He would be very worried about
Yeah.
this. I think it terrified all subsequent kings and queens, actually. I know that Queen Victoria, when she was a girl, she was known for having a very fiery temper. One of the things that was thrown at her even then is, oh, you're going to end up like Mad George III.
Whether George IV did have a form of psychiatric condition, if less severe, I don't think we'll ever get to the bottom of that. We can't go back and talk to him, but we can look inside his body for the physical manifestations of disease.
So if you could pass me a PM40.
The large scalpel.
So I'm going to start by making a midline incision. So yes, you can see the fat coming up with the skin. Yes, it's very well nourished. The first thing I'm seeing here, Alice, is there's a lot of fluid inside his chest.
The lungs are just swimming in it.
Yeah, so what I'm going to need to do is measure this fluid to see exactly how much is there.
Yeah. Brett, this is a pleural effusion, isn't it?
Yeah, so he would have been struggling with his breathing.
Yeah. I mean, you really struggle to inflate your lungs at all. The pleural membranes line the inside of the chest cavity and the outer surface of the lungs. It's normal for there to be a small amount of pleural fluid in this space to lubricate the movement of the lungs as they inflate and deflate with each breath. But a pleural effusion involves an excessive volume of fluid in the cavity around the lungs, and it can even stop them inflating. Now I'm looking at these wounds again, and I'm wondering if this is what his doctors were doing. Could they have been doing a chest drain?
Yes, so they may well have been removing some of this fluid from his chest cavity to help alleviate his breathing problems.
Yeah. We think these scars are evidence of doctors attempting to penetrate the pleural cavity and drain the fluid pressing on George's lungs.
Sire, these dreadful spasms of breathlessness are very worrying. I fear there's already fluid within the membrane of your heart.
It's only by sitting up I can even catch my breath.
I see you still have your appetite. That's a good sign. A sign of a strong constitution. Now, this drain I have inserted should relieve the pressure around your lungs. It should improve your breathing. I think we'll need the pint jugs.
Sir Henry, do what you need to do. But I don't want to hear any mention or rumour of my apparent decay.
Of course, Your Majesty.
So I've removed around 3 litres of fluid from the chest cavities.
3 litres?
So all of this fluid suggests to me that there may well be an issue with his heart.
Yeah. Brett continues his investigation by extracting the internal organs, a procedure known as the pluck.
So Alice, there's a lot of pathology going on here. The liver straight away looks very abnormal.
It looks horrendous.
This will be as a consequence of repeated exposure to high levels of alcohol consumption.
So this is cirrhosis, surely?
Yes. Cirrhosis being the end stage of damage caused by a lifetime of excess.
Yeah. But did he die of liver failure?
No, so we don't have any jaundice. We don't have a large collection of fluid within his abdomen.
So his liver was failing, but that didn't actually kill him?
Not at that time, no.
Okay.
No.
All right. George wouldn't have known that on the inside his liver was becoming increasingly cirrhotic, but he knew he was unwell and that he was putting on weight. We don't know exactly what drove this behaviour. It must have been a combination of his personality and his experiences, but it just continued. He kept on damaging his reputation, damaging his body. He just couldn't stop. Modern research is shedding new light on obesity, not just as a disease of the body, but also of the mind. I've come to Imperial College London to meet surgeon and historian Professor Hutan Ashrafian, to learn how George's gluttony would have affected him physically and mentally.
Hutan, we know that George IV was obese, incredibly obese actually, by the time he died. And obviously we can see the effects on the outside of his body. But what are the effects inside? What are the effects of obesity on all of the different organs?
The amount of obesity that George IV had is something that would have affected everything, not only his body organs and who he was behaviourally. So it's a multi-systemic condition.
It's affecting everything.
Everything, from his brain to his joints, to his muscles, to his blood, sugar levels. For many years, people have associated obesity in terms of a purely physical problem, but actually in maybe up to 80% of patients, people are suffering with associated mental health disorders.
So there's no magic bullet. It's a very complex disease, and the treatment is complex as well.
He would have been a patient today in a clinic, and people would have done a lot of things to optimize his care, but he would have been looked at holistically. So it would have been his physicality, his difficulty in mobility, his lifestyle, his nutrition, and his mental health. These all need to be addressed, and I feel that they weren't in his time.